So as we come kind of closer to the end of the show here, let me pick your brain here a little bit because because you and I use a lot of social media. I probably use it too much, but um, what are your ideas? And I know we've talked about this before, as far as for family medicine, family docs, to share our story out there with patients, with the public. Um, and utilizing social media, how can we bring along some of our colleagues to help share our story? Using blogs or podcasts or video or Twitter or Facebook, to try to reach people.
Yeah, it kind of goes back to something that I had mentioned earlier about showing up and being present as being part of leadership. It's very clear that social media is being utilized for both good and evil, and I'd like to think family physicians as wanting to do the right things for their patients and their communities. And if we're kind of to really stretch an analogy that's often used at AASP meetings, which is, if we're not at the table, we're on the menu, right? And I think that in order to be at the table, we need to speak up and make people know who we are and what we stand for. And I think social media is actually a wonderful way to do that. And I would say less than half of the people that I'm friends with are not physicians. And I've had some very thoughtful messages from people, not on my wall for public consumption, but kind of email messages back and forth, asking me questions about, gee, what is it like as a family physician on the ground? Is this healthcare reform stuff good for us? I'm worried about this. Do you think this policy change is going to be good or bad? And it allows, it's a different way of dialoguing with people. And I think it can be potentially very powerful. And I'm glad to see that there's more and more family physicians and medical students that are out there, sort of waving the flag, saying, "Hey, we're an important specialty. We're the core of really what people want out of the American healthcare system."
I mean, I couldn't agree with you more, and I think that. And a lot of people, especially in primary care, family medicine, family doctors, have said that we as a specialty have allowed ourselves to let other groups be advocates for themselves. And we have really dropped the ball on that. And we're really trying to play catch up as these other groups are. Some of them are very politically savvy when it comes to the halls of Congress and state legislatures and things, in trying to get certain legislation passed, whether it would be for increased pay or increased services or increased scope of practice. And primary care, especially family medicine, have not really done a great job with that, and we're really kind of falling behind. And as I go to these meetings, I hear a lot of frustrated people out there, and when I come home with a lot of apathetic people, there are very frustrated people at home too, who and I know you've experienced there too, that don't want to do anything. They are willing to complain, but they're not willing to do anything, and it's very difficult to try to get people to be empowered, to try to take control of their job, their specialty. So I'm just trying to find creative ways of doing that, and I'm seeing that social media can help with that to some point, but I know that social media is only part of the bigger picture.
Yeah, and I think that that's very true, because I think I forgot who it was, but someone recently posted that there was a Facebook group against human atrocities, and they had like 300 members, and someone's comment was, "Well, good job. The three of you are really going to reverse human atrocities." And maybe you feel good by joining the group, but really ultimately the responsibility falls upon you to do something with that feeling, and not just be like that character on oh God, I'm blanking on the movie now. In any event, the important thing is to be engaged in what it is that you care about, and whether that be things that you do at home or kind of like what we do in the clinic. We spend a lot of time talking about some of the system issues, and one of the things that we do is we ask patients, "Are you registered to vote?" A really, really simple thing that can be done and that can be asked. You asked about their mammogram or whether they've had vaccines, and then you say, "Are you registered to vote?" And they say, "Well, why is that important?" And I said, "Well, you've been complaining to me about the fact that there's too much violence in your community to be able to go out and walk. You've been complaining to me that there's not enough fresh food choices. Well, do something about it. Don't just complain about it. Get yourselves organized, and this is the first step towards that." And I think that if we start engaging our patients that way, beyond the stuff that they just gloss over, like, "Gee, you really should cut back on the salt," then we're actually giving them real solutions for how to get this to happen. And it's not going to happen easily. It's got to be one patient at a time, one physician at a time, one medical student at a time, one American at a time, that we're going to be able to get to that point.
So Dr. Jay Lee, thank you so much for being on the show here. So you blog a little bit for the California Academy there?
Yeah, a little bit.
Okay. Well, you should do more. You should do a little bit more. Maybe even maybe I can bring you back on the podcast here. We can really wonk it out. Be wonk wannabes.
Okay.
But thank you so much for being on the show, and this has been a blast. It's been a good time, and thanks again to the California Academy of Family Physicians for giving us a little shout out on their Facebook page. But it's been great talking with you. I have to bring you back because this has been a great conversation. We can talk about anything for an hour, and it will be entertaining, I think.
Thank you. I really enjoyed this a lot, and looking forward to seeing you on Facebook Landia and Twitterville.
Okay, great. Well, we'll talk very soon, and you have a good night.
All right, take care.
Okay. All right, kids. So that's my show here for the night. I lost my audio, so don't know what happened. So hopefully, Blog Talk Radio is still recording this. But I'm done here this evening, and I apologize for the end of the show here where I lost the audio here. I thought I extended the show past the top of the hour, but I guess I didn't, or Blog Talk Radio didn't hear it, so apologize about that. But I do want to thank my good friend here, Dr. Jay Lee, and he is I think he is on the board. Yeah, he's on the board of the California Academy of Family Physicians. He is Health Policy Director at Long Beach Memorial Family Medicine. So that's all I have for you here, kids. So check out dranonymous.com for our great shows coming up in June. That's going to be fun. And go to the blog, dranonymous.com, to go to the Facebook page, dranonymous.net, and the iTunes page, dranonymous.org. So there's no closing song because I don't even know if I'm still on. So I will say good night, everybody, and have a good weekend.